back here at one of my favorite spots. I was hoping to get the place to myself. I've been trying to get away from everybody and everything as much as possible. Hasn't really been that easy to do lately, but I'm out here on my trusty steed. Wanted to talk to you guys today about addictions, what they used to call addictions. Some call it substance abuse. I don't really prefer to use those kinds of terms. I prefer to use recovery or substance use recovery, and I've been working in that field for a long time, ever since 2009. A lot of people ask me too, they kind of want me to qualify as a therapist as to whether or not I have my own story. So I do. Just want to be out with that up front and say that don't really include that in my sessions with folks unless they ask me specifically about it. So it's not something you're just going to hear from me on the onset. And I'm also going to do this video in segments because there's a lot of interruptions. So I'm just going to pause here and there, and we'll kind of go from there. So bear with me. Today I'd like to talk about the dark side of substance use. I wanted to start out with that, not because I think it's the most positive, or this isn't a scare you straight kind of video. This isn't, you shouldn't do substances because all these terrible things are going to happen, or you're never going to make anything out of yourself, or these kinds of things. I'm not trying to say that. I do, however, want to talk about some of the critical issues with it, which is, how do we define substance use disorders as therapists to start? So if you've been given a substance use diagnosis, what does that mean? Remind me to tell you the story about the time I went hiking in the Superstition Mountains in Arizona, which is a certified wilderness. I don't know what it is. I can literally go to the middle of nowhere and I'll run into somebody, or I can park at the edge of a parking lot at, a Walmart or a mall or anything like that. I can literally park at the end of the parking lot, the furthest away from the store, and people will inevitably pull up next to me and park. And so I don't know what that is. Maybe you guys can leave a comment down below and tell me what your theory on that is. How is it that when we go somewhere and we would like to be alone, that inevitably someone shows up? Okay, so now I'm going to go on and talk about substance use disorders and what it means as far as a diagnosis is concerned. It's just like any other mental health disorder. I don't differentiate between mental health disorders and substance use disorders. They're both contained in the same DSM-5 that we're using when we diagnose clients in a clinical setting. So it's important to know that right off the bat, even though the medical model may see addictions or substance use disorders in a different light, and there's a lot of negative connotation attached to it. It's probably one of my favorite areas to work in, if not my favorite area. And I just find that I resonate with a lot of people there, and we make a good connection, and we have, really productive therapy sessions, and we make a lot of progress. So it's important to me. It's close to my heart, like I said. That's why I wanted to do this video, is just to reach out to you. If you have substance use disorder, or you know someone with a substance use disorder, it's really important to know that I'm not judging and that I don't have a bias against that like some folks do, or they're trying to separate out your mental health and your addictions or substance use issues, which I don't do. So what's important to know about substance use disorders and their diagnosis? The most important thing to know is it's just like any other mental health disorder, where if it affects your functioning in some way, then it might be a problem. I'm not going to say that just because you think you might have a problem or someone else thinks you might have a problem, that you would consider that a reason to get treatment. A lot of people that know they have an issue aren't motivated to do anything about it. So if you fall in that category but you find yourself in treatment, it may not be a good fit at this time. So if finances are affected, relationships, work, school, your physical fitness, your health, these kinds of things, or any of those things are affected moderately to severely by substance use, then we generally consider that significant criteria for a substance use disorder diagnosis. And so then how do we treat that? Well, there's lots of different ways we can do it, and it really kind of depends on the severity of use and how it's impacting you. So let's also include in there that there may be some underlying mental health issues. Most of the people who come to me and talk about substance use disorders have some other diagnosis as well, whether it's depression, anxiety, it's PTSD, it's trauma from the past. People didn't just start using substances in a vacuum. There's significant reasons and problems that people have that once substances are introduced to them, then they become something that they tend to rely on more, and it does become a habit and a lifestyle. So it's hard to walk away from that habit and lifestyle. And like I said, if you don't feel motivated to seek help for these kinds of things, going to treatment probably isn't going to have much of an effect on you. Now, I'm not saying that I've never been able to help somebody that was thinking about trying to get sober or recover from something, and they didn't really want to, and then they changed their mind. I've seen a lot of success when people just address their underlying mental health issues. So I do want to encourage you about that. But what I want to say is the dark side of substance use disorders is basically the breaking down of life as you know it. It's not the kind of life that you could live if you were not using substances, or maybe if you didn't have a problem with alcohol. I'm not going to throw in things here like nicotine use or caffeine or those kinds of things, because those are just so predominant and they typically don't have a major effect on someone's functioning. So a lot of people in recovery actually still smoke. And a lot of people will say, well, you know, I've given up alcohol or I've given up drugs and these things, and I just don't want to give this up yet. And I'll usually encourage them, go ahead and quit, because it's the easiest time to quit. And that means that everything is going to be hard. If you're first trying to get off drugs, alcohol, or any kind of negative habit that's really affecting your life in some profound ways, it's going to be a difficult time, and you need a lot of support for that. And I'll cover that in the second part of this series, but today I just really wanted to touch on the diagnosis, motivation, and I also wanted to say that if you're seeking treatment, that's a good thing. If you think you have any kind of an issue with it, just go ahead and seek help for it. And I hope that you find the help that you need, either with myself or with somebody else. But therapy is always an excellent addition to recovery, especially when you have a lot of life issues that have happened throughout use, such as divorces, losing jobs, losing custody of children, not seeing your children, damaged relationships. Maybe your finances are in disarray. And I'm not saying that I'm perfect and that I have everything going on for me all the time, because I don't. I'm just coming from a place of, I know what it looks like, I know how it feels, and I do have a lot of tools to help people with who are in those set of circumstances. So it's important to know that, and it's important that you do get good therapy. And if you want to seek help through 12-step programs and things like that, feel free. There's a lot of misconceptions about that. I will be putting out a book about 12 steps, trying to simplify that, so be looking for that in the next year. But a lot of people have misconceptions about support groups. Just know that there's a lot of different support groups available to you, and I'll talk about that in the second video. But if you're trying to go into recovery from substances and you don't have any additional support, especially peer support, it's going to be really hard to get through even that first month. Because the other people that you may spend time with may not be supportive of it at all, or they may not understand it. They may not even understand that it's a mental health disorder. So that is kind of the dark side, and it seems like you'll be facing it a lot alone in the beginning, and you don't have to. So I just want to encourage you that if you are seeking help and things feel dark right now, stick with it and it'll get better. Alright, so I'm going to try and make this quick here. It's fresh after a rain, and I was trying to capture some of the nature sounds. I had some toads in the background that were making neat noises, and some birds, and lots of different things, but I'm also hearing some thunder right now, so clouds are rolling in, storm's going to come back, I'm going to have to ride back.